Perhaps the most relaxing part of the treatment is the head and scalp massage. You can adapt anything that you already do for this. We're just working again a little bit differently because to start with, we're going to have Lauren laid down. One of the nice things to do is just circles all around the head. Now, I'm not just moving the hair. This isn't the same as being at the hairdressers where they move the hair. I'm going through the hair. I'm pressing my fingers in a little bit, not so that it hurts, but just so that you can see the whole of the scalp moves. If I come to the edge, you'll be able to see that better. See, the whole of the skin across the scalp is moving. And we want to do this right throughout, right across the hair. Now, you can't get all of this in this position because obviously Lauren is laid on part of her head, but just do what you can, get to what you can. If your lady's not too tired, if it's not maybe a multiple pregnancy or it's not very late in the pregnancy, then you can do this seated as well. It's just if she feels the need to lie down that you can do this laid. I tend to do it seated just because you can get to more. So it's all these gentle circles. It can be quite random across the head. You can keep your hands together. You can move your hands apart. It's not unusual for a lady to fall asleep during this part. Again, a move you will see better when we do it seated is following the midline down, and we're just going to use our thumbs together, press on the midline and release. Press and release. Press and release. Press and release. Normally I keep my thumbs together, but because of the angle I'm at, I don't want to end up catching Lauren's head with my nails, so I'm putting my fingers next to each other instead. So press and release, press and release, and you can come all the way down. You can do more of that work on the base of the skull that we did when we did the shoulders. Moving those circles. So it's the same circles that you did across the scalp, but it tends to be a bit more tender here because a lot of people will carry their tension here. So you can come right across the base of the skull. We can get right across here. We're not stopping part way because of the laid position. And then a move that's often described as allowing your scalp to breathe is just very gentle hair pulling. So you need to gather quite a bit of hair, and it's very gentle pulling. It's not in the playground where you're pulling down and pulling a big clump of hair. You're getting hold of a handful of hair and you're pulling directly out at 90 degrees from the scalp. You can see I'm just moving the scalp by doing this. You can do one hand, you can do two hands. But the lady shouldn't be shouting ow. It shouldn't be a painful move. It should be a nice move. It's kind of like just allowing your scalp to breathe. You can do head stroking, just using the tips of your fingers. This is a relaxing part of the treatment, so anything that you normally do in your head work, you can integrate into this. It's simply the change of position that's important. So now we've seen that laid down, let's see it seated. So now we move to this head work seated. This is the easier way to do this work. You can work with the small circles that we saw laid down. You can work anywhere on the head with these. It can be nicer when you're doing this seated that you can work on opposite sides of the head, but you don't have to. Just be careful that if you're putting pressure on this side of the head that you're not pushing the lady's head over to one side. So that is the advantage of doing both sides together. The press and release work that we did, I normally do with my thumbs, but it'll be easier to show you with my fingers. So we're following the midline, just pressing, releasing, moving along. Pressing, releasing, moving along. Pressing, releasing, moving along. We're being careful not to pull the hair here. Make sure that you've not got a kind of a tight grip between your fingers so that you're not pulling hair with you. And you can do that all the way back onto the head. Tend to stop around the crown of the head. So again, this is so much easier to do with your client seated. We can go back to those circles at any time. We can go back to any of these moves at any time. The hair pulling that we saw laid down, we can easily do seated. Again, try and pull opposite at the same time. If you're on the sides, it just makes it more pleasant for the lady. You can see it's not a big pull. It shouldn't be painful at all. It should be gentle. We can come back to the circles again. The work that we did at the base of the skull, we can also do here. If you took your thumbs underneath the hair, just find the base of the skull. Make your hands steady by holding them here. And you're making those, again, small circles at the base of the skull, just as we did before. And they're really mirroring those circles that you're doing elsewhere. You can also do a little bit of facial work while your client is seated. I tend to use a little lotion for that. Again, it's a plant-based organic lotion, so I'm not introducing any chemicals in. I'm just going to put that a little bit across the forehead, just so that I'm not dragging the skin. And you can do this kind of press and release, the press and release that you've done on the midline. You can do across the forehead. It's very relaxing. You can use your fingers and just follow the line of the eyebrow across. If there's any tension here, you can just smooth that tension out. I'll just show you that bit again. Fingers together, moving from the midpoint outwards. Just a very gentle press and release. You can do that just in a smooth motion as well if you prefer. Finding the inside point of the eyebrow and just working across. Check I'm in the right place here. Just moving across the eyebrow. You can do that upwards movement just to smooth. But remember, this is your head work, so long as you're working in a safe way for pregnancy, you can adapt to any of the head work that you normally do. This is, especially if you've just worked the lady's hips, this is a bit of a treat for doing the hips work because they will feel the hip work. So this is now the relaxing work that we finish the treatment with. And we're sending them out nice and relaxed to carry on doing that important work that they're doing in pregnancy, but supporting the body and just giving that little bit of extra support to the lady in this time.